Hi, hello everyone. Today we are going to discuss the topic bradyarrhythmia. Brady means the low heart rate, arrhythmia means abnormal rhythm. So, patient with the low heart rate with abnormal electrical rhythm or contraction is happening. In that time, we are telling bradyarrhythmias. So, we have the three part in that. The first part, we are going to discuss basic of ECG. In second part, we are going to find different types of arrhythmias and what is a pattern or how to identify, how to confirm. So, what are the criteria we are following it? And the last one, that is the what the management for same rhythm or arrhythmias. So in starting, the conducting systems are most common or most starting part of your ECG. That is conduction and contracting is happening together. So when only the ECG waveform is developing. So your heart is conducting system is a network of the nodes, group of cell that can be either nerve or muscle tissue, specialized shell and electrical signal that keep your heart beating. You all understand. So there is a specialist cell is there, and I also have the electrical signal in that muscle. Then only it's making your heart to beat. That's a two type of control cell. Uh, your heartbeat. That is a conducting cell. Conducting cell carrying the electrical signals. Muscle cell control your heart contraction. So conducting. So heart is getting contraction. That is due to muscle, and you are getting impulse from that. That is the cell. That is the electrical signals. Different between heart rate and heart sound. Heart rate is the number of time your heart beats in a minute, while heart sound are the sound to produce your heart when the valves open and close. There is a different per minute how much you are getting the beats, that is the heartbeats. In the same that sound you are getting, okay, how it's happening, it's produced when your valves open and close. Heart rate, a normal resting heart rate for adult is between 60 to 100 beats per minute. Always the heart rate for adult people when they have resting 60 to 100 beats per minute. A lower resting heart rate usually indicate better cardiovascular fitness and more efficient heart function. Heart sound are generated by the tubulars created when the heart valve close. You can hear the sound with the stethoscope, which can provide the information about start of your heart. Okay, so heart sound will provide when your tubules or valves is getting close or open. So how you can find with the help of the stethoscope, you can find the information what is the current state of your heart. Heart rate generation. The heart rate is a rhythmical generation by the SA nodes, sinoatrial nodes. It is also influencing by the central factor through the sympathetic and parasympathetic nerves. Nerves influence over the heart rate is centralized within two paired cardiovascular center of the medulla oblongata. So, who's the cardiovascular center? That is the medulla oblongata. So, it's we have the sympathetic action also, and we have the parasympathetic action also. Heart sound, the duration, first heart sound is also known as lub, that is S1. It's shorter than the duration of second heart sound, also known as dub. So we all know lub dub, that is a heart sound. So that is the S1, that is a lub sound. S2, that is a dub sound. First heart sound is a lub. The first heart sound occurred when the atrioventricular valves close. This happens at the end of the zero point 0.1 second. It's getting time to close, that is 0.1 second. That AV node is getting close, that we are calling as a lapse. Second heart sound, that is second heart sound occur when the semilunar valve close, which happened at the end of zero point 0.3 second. Clear? Time between odd sound, the time between the first and second odd sound about 0.2 seconds. The interval represents time to take for heart to complete the cycle of contraction and relaxation. Why the time 0.2 seconds? There is a contraction and the relaxation is happening. So we want the time, that is the 0.2 second, to get the interval, that is for contraction and the relaxation. So heavy node close, that is giving by love sound, and semilunar valve close, that is giving by dub sound, and second between the two lub and dub there is a 0.2 second gap, that is for contraction and relaxation of your heart. Heart sound generation. So you can see the picture, what is happening on the, what is the lub sound and what is the dub sound. You can hear. So lub means S1, dub means S2. We have four sound S3 and S4. If presence of S3 and S4, something is abnormal is happening in our heartbeat. So we will see normal AV node close. You are seeing that graph of arterial pressure and the ventricular pressure is high. So at the same time, you can see that lub sound is producing how long on the dub sound. Lub is the longest sound, dub is the shortest sound. So when AV valves is closed, you will get the sound production of your lub. When AV valves is open, you will get the dub sound. So this is the way you are getting the lub and dub sound. And all the valves, when AV valve is open, seminal valve is get close. When AV valve is closed, seminal valve will get open. So in the same way we are getting. That is the thing. So AV valve is closing and the same time seminal valve is get open. That time you will get the dub sound. When AV valve is open, seminal valve is getting close. That time you will get the dub sound. I hope you all understand. So when AV is closed, seminal is open. When seminal is closed, AV is open. In the both way, your lub and dub is get produced. Your atrium top chambers telling them to contract. Atrioventricular nodes delaying the signal until your atrium are empty of the blood. The bundle of is the central bundle of nerve fibers carrying the signal to the Purkinje fiber. The Purkinje fibers to your ventricles, bottom of out chamber, causing them to contract. So signal the top chamber from this SA node, the chamber is getting heavy node to get the signal. When your atrium get contract, that empty time is getting signal. Once get the signal, is giving a central of bundle of hits and it's going in Purkinje fibers. Purkinje fiber is a bottom of the ventricles. Then it's telling to contract. The autonomous nervous system include your sympathetic nervous system, fight or flight response, make your SA node very fast, which increase your heart rate. Parasympathetic rest or digestive response make you SA node slower, which is decrease your heart rate. In starting, we had this nervous system function and sympathetic and parasympathetic. So if you are getting heart rate is more, that is a sympathetic action of your heart. If you are getting low or heart rate, that is a parasympathetic action of your heart. So finally, this image we came to know what's happening, where what is called a depolarization. It's called contraction of your heart muscle. Repolarization, it is called relaxation of your heart. It's clear. And always atrium also is doing contraction and ventricle also is doing contraction, and atrium also is being relaxation, ventricle also being relaxation. So when PVA is produced, what is happening? The atrium is getting depolarization. It's called atrial contraction. When you are getting QRS complex. When you are getting QRS complex, that ventricle are getting contraction, that is called the depolarization of the ventricle. That time you will get the QRS complex. Repolarization. Then when you are seeing the T wave, it is called repolarization of the ventricle. So where the atrial repolarization, it's not showing there, but it's happening simultaneously when your ventricle is contracting because of lower amount of blood of your atria. So you couldn't feed the waveform in ECG graph. So ventricle is a large chamber, so you can view the T wave as in the ECG form. I hope you all clear with this image. It will show better understanding of your ECG knowledge to go upcoming classes.